Sure. Okay, well, why don't we get started now? And like I said, I am recording and we'll share this widely. This is the first time we're doing a CCE orientation. And so thank you for everyone who's coming and listening to this. Sometimes it's a little hard to really get into the committee because we use a lot of acronyms and a lot of background that all the committee members aren't aware of. So I wanted to just spend some time this afternoon going through kind of a who's who and what is CCE and what is our curriculum, and kind of an orientation so everyone knows what everything is. And so please ask any questions you have. I want to make it as informal as possible. And if you have questions, other people probably have questions as well. So first, CCE is the Committee on Curriculum and Evaluation. And I've gone through, here's the Rush Medical College vision. Many of you know this. The Rush Medical College will be the global leader in student-centered, future-oriented medical education. And the mission is through a supportive and dynamic learning community. Rush Medical College nurtures the development of empathetic, proficient physicians dedicated to continuous learning, innovation, and excellence in clinical practice, education, research, and service. So here's just some Rush Medical College enrollment numbers, a little bit dated. Generally now most of our classes have about 150 students with a similar breakdown of male and female. So I wanted to spend some time, since there's a lot of people at the committee and a lot of questions as to who is who. So Dr. Baker, our Senior Associate Dean, does come to CCE meetings from time to time. Dr. Rahul Patwari is here, I believe, today. He is the Associate Dean of Curriculum and is also very involved in CCE meetings. Robert Levin is the Assistant Dean of Pre-Clerkship Education, and Amy Zwecka is the Assistant Dean of Clerkship Education. They usually attend some of the CCE meetings. Dr. Levin usually attends the pre-clerkship, Dr. Zwecka usually attends the clerkship committees. And Dr. Svengros, who's I believe is also on this call, is the Assistant Dean of Accreditation and Continuous Program Improvement, and also the Director of the Clinical Communication Skills Training and Research. So she is involved from kind of an accreditation standpoint to help keep us on track and make sure we are doing what we need to for LCME. So most meetings have at least a couple deans from Rush Medical College to help provide some background and other information that may be helpful to committee members who aren't as experienced in clerkship or pre-clerkship education. So our curriculum and assessment team also is very involved in our CCE. They also work with directly the OIME, which is Office of Integrated Medical Education. So our curriculum team is led by Dr. Currents, who is also on this call, the Director of Curriculum and Education. Jasmine Moore, Agata Soweka, probably pronounced your name wrong, Agata, I'm sorry, are also involved in kind of the administration of CCE and faces that you'll see often, at least through Zoom. Our assessment team is led by Dr. Ann Carroll, Dr. Seabrook, Dr. Stringer, and again, Dr. Svengros are also involved in the assessment team. So the curriculum and assessment team kind of both are integral to the, I guess, the curriculum as a whole and the function of our CCE. I'll go through some of the details a little bit more later. Yeah, all of the people I've mentioned so far are ex officio members. They're not faculty members of CCE, but help with background information, kind of explaining assessment modalities, explaining curriculum modalities, and assisting with getting data or information that we may need to help us answer our questions and evaluate the curriculum. So finally, in terms of leadership, so I'm the current chair of CCE. My term ends, it's been a 2-year term, ends in June, at which point Joanna Cuppy will take over the CCE chair. Nirel Sheth has been vice chair, but due to other responsibilities, he won't be chair. And Ami Shah will be the upcoming vice chair again in July when we switch over. So as I've alluded to in some of the previous emails, we have 3 different subcommittees under the CCE Executive Committee. There's a pre-clerkship subcommittee. The current chair of that is Joanna Cuppy, but of course she is going to be chair of the Executive Committee, so she will no longer be pre-clerkship chair. Ann Hartley will be the pre-clerkship chair as of July. The clerkship chair is Dr. Elizabeth Van Opstel. Her term is ending, and so the chair in July will be Dr. Marmontsef, who is also on this call, I know. And Roles and Threads Subcommittee, the chair through next year is Dr. Viju John. So there will not be a change in leadership in that subcommittee. The vice chair of that subcommittee is Dr. Chris Ferrigno. And we currently do not have vice chairs for pre-clerkship and clerkship subcommittees, but we'll be electing and nominating for those positions in the next couple of weeks. So CCE's role in the curriculum, again, is outlined in Rush bylaws. The CCE is charged with the overall design, management, integration, evaluation, and enhancement of a coherent and coordinated medical curriculum. So what we do in CCE, we review the curriculum, we find changes that can lead to significant improvements, and then we follow up to ensure that change is implemented. So CCE reports to Faculty Council, as well as we sit on and report back and forth with the University Assessment Committee and the University Curriculum Committee. And those committees are, again, university-wide, include College of Nursing representatives, graduate college representatives, medical college representatives, and they also kind of outline ideal assessment and curricular modalities. So then the CCE Executive Committee is made up of leadership of the subcommittees, and again, kind of communicates and oversees the curriculum management of the subcommittees. And as I've mentioned, the 3 subcommittees which kind of work in parallel include the pre-clerkship phase subcommittee, the clerkship phase subcommittee, and the Roles and Threads subcommittee. And those committees are made up of the ex officio members that I kind of listed earlier on some of the slides. Those subcommittees include everyone on this call, kind of new faculty, as well as existing faculty membership. There's also students. There's 4 students that sit on each of these subcommittees, and their input is always invaluable, kind of giving the firsthand experience of the curriculum and review, critique. So the CCE's committees, and this is kind of in all of the CCE's committees, are responsible for reviewing Rush technical standards, required and recommended prerequisites. Usually that's CCE Executive Committee that does that. Recommendations to OIME for faculty development, faculty replacement, and preparation of non-faculty instructors who are instrumental in the curriculum. As much as possible, that is done blinded. And recommendations to OIME and RMC administration regarding the learning environment. So we do separate reviews on learning environment and incorporate that in all of the reviews that CCE does and is responsible for. So the CCE Executive Committee, again, just by our bylaws, we develop and execute processes to ensure curriculum is measured by thoughtful program design, program implementation, program evaluation, and continual revision. So whereas the pre-clerkship and clerkship subcommittees look towards what are we teaching, why are we teaching it, and how can we plan for innovation or revisions? And is the way that we're teaching it kind of best for students? Are we supporting remediation? We look at how are our assessments? Are they reliable? Are we comfortable with the assessment methods? How the assessment methods are used in determining a final grade. Look at faculty, kind of like I've already alluded to. So roles and threads is a little bit different, and I'll go through again kind of how our curriculum is laid out in a minute, but the roles and threads subcommittee looks at is our program preparing students to be future physicians based on our RMC roles-based curriculum and program objectives. We look to see how do we know that they're prepared, and are we teaching them what we want them to know, and are we assessing again what we need to know? And that is essentially what roles and threads subcommittee looks at. They also will look at our kind of longitudinal programs that vertical programs that span all 4 years. So the roles and threads subcommittee specifically looks at the roles curriculum. So probably about 5 years ago, Rush Medical College changed our end program objectives for each student to a roles-based curriculum that was based, I believe, on the Canadian Medical Society's recommendations. So we want all of our students to be advocates and have program objectives related for advocacy, collaborators, and again, we have program objectives related to specifically collaboration, communicator, educator, leader, practitioner, professional, and scholar. And so we have sessions and objectives throughout all 4 years based upon each of these roles. We have curriculum built, again, for the roles and assessments for roles. And each of these roles surrounds our overall kind of medical knowledge piece. And that's where all of the anatomy and physiology, are we teaching them what we want to teach them in order to be a successful physician, as well as all these other roles. So again, roles curriculum is kind of our end objectives, which we want every graduating medical student to be able to meet. So again, here are some of the disciplines for medical knowledge that are laid out a little more detail in the pre-clerkship curriculum. So we have specific disciplines of anatomy, biochemistry. I'm not going to run through all of them, but when we assess, we want to try to look at how are we teaching each of these. We want to use kind of our step 1, USMLE step 1 and step 2 exams to evaluate, are we teaching pathology in the way that we want to teach it? not just USMLE, but that's kind of one of many ways that we will use to look to see, are we teaching what we need to teach? So we've implemented a new review process this year. We're kind of in the process of rolling this out. LCME visited in 2020, and we overall had a very successful LCME visit. One of their concerns was regarding the CCE. And so we're making even more concerted efforts this year and in the upcoming years to try to fulfill LCME requirements as dictated. LCME is the accrediting body for our medical school. And so their concerns included that we weren't doing phase review or whole curriculum review. We've been doing course reviews for many years, and we've done some horizontal reviews, but we haven't really done the review in the way they were looking. So as a result, we restructured our subcommittees, which looked a little different a few months ago. Probably doesn't matter. I'm not going to go into how they did look, but kind of what our plan is going forward. And so the phase of a curriculum, LCME defines as kind of the pre-clerkship or the clerkship phase. So everything before getting into clinical rotations is the pre-clerkship. So there is some clinical medicine in the pre-clerkship years, but overall is focused on basic science. And we'll go through a case-based basic science curriculum. And so we'll go through some of that in the next few minutes. And the clerkship phase is everything M3 and M4 year. We have not separated, even though M3 and M4 year look very different, we haven't separated those out. And we want to, again, kind of review as a phase. Are we teaching everything in M3 and M4 year that we think a practicing physician should know? And so that is what wasn't done. That is why LCME cited that particular issue, even though we had a very successful visit. That is what we will be working towards accomplishing this year. So with our restructured committees, we've also increased membership to help with some of the kind of increased responsibilities of CCE, as well as implemented a new course review process. So in the past, so we've been doing course reviews for many years on all required courses, as well as some electives. What we are going to do now is a little different. In the past, we kind of got a lot of information, and as I think Dr. Svengross probably puts it best, in the past, we spent a lot of time, if we're thinking about a research paper, going over the results section, but we want to take it to the next level and have our reviews look at discussion, the discussion section of a paper. So we want to spend less time reciting results and more time analyzing what we want, why are the results the way they are, and how can we use these results to make lasting curricular changes. So for that reason, this new process involves having our curriculum and assessment team, I kind of introduced that a little bit earlier in the discussion, come up with packets of information for each course regarding what we're teaching and the assessments, from student evaluations, from shelf exams, from USMLE exams, from a variety of different sources, so that all members will have this glossy packet prior to a review. And we'll have opportunities to review, how the course is rated. What are some of the student comments? What are common learning? What are there learning environment issues? And if so, what are they? And how are they inhibiting our delivery of the curriculum? So these packets will be put together by our curriculum and assessment teams from OIME at least 2 to 3 weeks before the review. Then all of the committee members will have a chance to review these packets before a meeting and answer a couple of yes/no questions with explanations. Ultimately, it's not really the yes or no question, it's the explanation that we want to go into further. So a question may be, are we teaching, are we teaching immunology the way we need to before clerkship years? And you may say yes or no based on what we're seeing in immunology. Fine. After that, OIME, the Office of Integrated Medical Education, will compile the answers so that we can discuss during the meeting all of the no's or the areas of some controversy. No, we're not teaching immunology the way we want to. The students couldn't receive this curriculum because of ineffective study guides or ineffective teaching or whatever it may be, or yes, they can, and let's move on to another question. So during the meeting, either one member or small group will focus on some of these discussion points based on the compiled answers. So in the specific questions, are we teaching immunology the way we want to teach? Those questions I'm calling the guiding questions, and will vary from committee to committee and may vary from year to year. So those questions we have kind of already determined, but in the future we can change as we want, since ultimately it's us as CCE membership that determines what questions we want to ask. OIME, though, of course, has been instrumental in helping us get this data and provide it in nice graphic formats and usable formats. So they've done kind of an amazing job putting together information to help answer those questions. But in the future, if you're finding areas that are confusing, we can change, we can ask OIME to potentially phrase things different or display the data in different ways. Ultimately, we can also change the guiding question. So if we want to go through immunology one year, that's fine. And maybe the next year, we want to go through microbiology or something else. But ultimately, we as CCE can kind of decide what questions we want to ask. And during the CCE meeting, kind of like I've discussed a little bit, we'll discuss the data, pay attention to discrepant answers, and many of you may come from different areas in the curriculum. We've purposely put people who have a variety of backgrounds in all different committees. So in clerkship and pre-clerkship and roles and threads, we have representatives from M3 year, M4 year, and the pre-clerkship years. We also have faculty at large who may have very little background with our curriculum. And we've done that on purpose so that we can have a variety of opinions and input for these reviews. So that we can have kind of a more diverse background and review of this data. So while the CCE members will be the ones to mostly lead the discussion and come up with action items, we'll have course directors and role leaders and OIME and course directors available to answer any questions and clarify points. So if we want to know why aren't we teaching more immunology, one of the course directors may say we took it out because of X, Y, and Z, or whatever points they want to clarify. We have a new leader for immunology this year that we may not know without that clarification. And when we ultimately decide action items, those course directors and OIME will be able to leave the meeting so that CCE members can kind of freely discuss and come up with action items to say, we need more immunology. We need a new study guide for these topics or for these sessions. or whatever, again, it may be. So we'll finalize action items, come up with census summaries, and after the review, it will go to executive committee and we will follow up in subsequent meetings. So we asked you to improve immunology. Again, it should be in SMART goal format, probably not what I've just said, but that idea. And so what are the action items and how have they been followed up? So our documents right now are in Entrada, but we're currently converting to Teams, and we'll provide kind of more information on that in the future. So one question that I know has come up is what sort of compensation for this work? And so I've been told that every CCE members will be compensated for work done. I'm still waiting for the specific determination, but hopefully we'll get some more concrete information soon. But I was assured that CCE members will be compensated for work done. I've provided estimates of hours that CCE members will be doing, per month, similar to what everyone has seen in the responsibilities document. So now we wanted to spend a little more time on the curriculum and what it looks like, especially for those of you who may be involved not at all or in only kind of small areas. And again, if other people, I have much more experience with M4 and M3 year than M1 and M2 year. So if anyone here who's on this call has more information, please go ahead and expand. But basically our first 2 years are a single pass curriculum. And there are, I think, 7 courses during the M1 year. Foundations of Medicine, which is an introduction, host defense and host response, which is immunology and microbiology. We have a vital fluids, vital gases, food to fuel, movement and mechanics, and brain behavior and cognition. So during each of these courses, there are cases, which again, we'll discuss in a little bit, to help teach these topics. Going in parallel, we have a few other programs, and these are some of the programs that I've mentioned, Roles and Threads, and other subcommittees will look at that are a little more vertical throughout the curriculum. So Explore, which is an early clinical experience program. There's research course, there's some electives, there's service learning. So all of these are done throughout M1 and M2 year, while students are also enrolled in courses. So M2, you can see the list of courses here. M2 year ends a little earlier than M1 year, so that there is preparation for USMLE, which is usually done somewhere in the April range probably. And then our clerkships begin in May. So here's just an example. It's not internal medicine for everyone, but you can see the calendar changes a little bit here because this consolidated cases, which is the last course of the M2 year, ends somewhere about February or March. So then the clerkships start in May. And we'll go through that in a little more detail, but we have clerkships including internal medicine, neurology, psychiatry, all of the basic core clerkships that are pretty standard across most medical colleges. And the weeks that we have, there's a little bit of elective time as well. Then, like the M3 year starts in May, the M4 year also starts in May. So you see in the sample schedule, emergency medicine and elective time in May. Technically, that's M4 year. There's a sub-internship, a variety of electives, interview time, and then graduation, which is in usually April. So that is what our curriculum looks like as a whole. And so our pre-clerkship curriculum, so this is our kind of stated goals, to better prepare students for the clinical environment, to emphasize knowledge and skills important to practice of medicine, even if they haven't been emphasized on USMLE, it's kind of a challenge balancing the preparation for USMLE with preparation for clinical medicine and clerkships, which all may be a little bit different goals. To achieve vertical integration in the single pass curriculum, like I explained. So I think the double pass being a more traditional model that maybe M1 year goes over normal pathology and what a normal cardiovascular system, how it would work, and a double pass curriculum would then the second year go through cardiovascular again, but go through pathology. So we've chosen a single pass curriculum to go through kind of normal and pathology in case-based format all at the same time. And we've also, this pre-clerkship curriculum was changed about 5 years ago. And with this change from this double pass to single pass curriculum, we've wanted to create an engaging experience. So we no longer have lecture-based passive approach, but a kind of reverse curriculum where students are expected to prepare in advance to offer a more, I guess, engaging and productive time. So when we think about phase review, some of our phase review questions will be based exactly on this. Are we preparing students for our clinical environment, for the practice of medicine? Have we been successful in our achievement of a one-pass curriculum, etc.? So again, I've kind of discussed a little bit already of our courses for pre-clerkship year. And I don't know, Princess, who is our curriculum manager in here, do you want to start going over some of the specifics regarding how we map and go through what our objectives and competencies are?
Sure. So you'll hear a lot of an acronym called CI. We'll say that a lot, and we're standing for curriculum inventory. And what you see on the page is really one of our governing bodies, which is the Association of American Medical Colleges. We have to report what we're teaching, how we're teaching it, when we're teaching it throughout the phases for the AAMC. And they have us do that so they can be able to map what is being taught at medical schools across the country and the ones that are also in the association part of Canada as well. And so they look at a series of factors, sometimes named as competencies or milestones or EPAs or objectives, but basically there's looking at what are your overall expectations for the curriculum. And they do that with a fixed set of expectations, and those fixed sets of expectations are called physician competency reference sets. And all of the medical schools across the country map their curriculum inventories to those set of PCRS data points. You can go to the next slide, Michelle. So for Rush, for our curriculum mapping, we are looking at what we're teaching when is it achieving our expectations, which is the assessment piece. And as I mentioned earlier, the point is to see if the content areas are what we expect, are the expectations being mapped across the curricula, are the instructional method used to teach matching our expectation, are the assessment method used to assess the achievement of those expectations, what we're really looking for. And so we in our curriculum have a topics-based structure, the way in which we're able to identify what we're teaching in the sessions that we teach across the curriculum. Next slide, please. So when you think about topics, you may have already been familiar with learning goals or objectives and outcomes. And oftentimes when you're coming into our curriculum, the question is, what is these topics that everyone talks about? Sometimes people may refer to them as TOs because every topic has a code in the pre-clerkship curriculum and also in some areas in the clerkship curriculum. And how we look at that is that our topics are the learning goals for a particular session. So it's generally what you intend the participant to learn. So what's your plan for them to learn? So in this session, they're going to be learning about foundational communication skills, for example. So the topic name is kind of a shorthand keyword for us to be able to identify the learning goal for that session. The learning objectives are specifically what is intended for the participant to learn. So meaning that what are the observable actions that you want to see that they learn how the fundamentals of communication. So what are the behaviors that you're going to observe to yield that learning goal? And then last is learning outcomes, what the participant actually learned. So that comes into the assessment. We had a plan for what we wanted them to learn. We had methods that we wanted to observe their learning. And then learning outcomes would be, did we actually do that? Did they actually learn that? And that's what comes into the integral part of the assessment data. Next slide, please. So in the pre-clerkship, we have a case-based curriculum within each course. And so, for example, one of the courses you saw on the block grid that Michelle mentioned earlier, we oftentimes refer to our courses as blocks. So you'll hear the vital fluids block or the food to fuel blocks, and that's the way we refer to the courses within the RMC curriculum. So for example, the vital fluids block that focus on cardiovascular health, you'll see that we have a series of example of 4 cases. There's other cases in that block, but this is an example of 4 cases. But if you go to the next slide, you'll be able to see in that slide, you have a series of topics that are with each a different discipline. So I think if you move your cursor, you'll be able to see the different the disciplines. If you go to the, yeah, there you go. So for example, there'll be a role topic that would be the healthcare system and uninsured patients. That's from the advocate curriculum. You have the practitioner curriculum topic of making a different diagnosis, and so on and so forth. So you, in our one pass, you have both the normal and abnormal, and also you have a continuation of care with that patient with the role curriculum. Next slide. So in our pre-clerkship curriculum, we have a flipped classroom. So where students have materials that they review, and we call our self-study. So this is in the form of videos or as notes or PowerPoint slides that are one-to-one to the videos in most cases, where students study that materials, or a textbook, study that materials beforehand. And then when they come to class, they're coming to class with their small groups, and they're problem solving around a particular case based on the foundational knowledge from their self-study. So I mentioned earlier, our curriculum is governed, of course, by you all as far as the RMC, but we're also governed by what we should be teaching with our accrediting body, licensed liaison of Committee on Medical Education. And I just mentioned the curriculum inventory for AAMC. To give you a little more information about the AAMC's curriculum inventory, how we use it is an international curriculum data repository. It's not a curriculum management system. There's no data entry screens, but the cool thing about the curriculum inventory, because it's a collection of what's happening across all medical schools, is an opportunity for us to pull data to see what everyone else is doing, where we are we in line or not with other schools, how we can particularly partner with other schools, maybe do something differently that we see we may want to adopt. Next slide, please. So the curriculum inventory in that mode provides graphical interpretations. It provides benchmarks for educational research. It's usually uploaded August to September 30 every year. And it's a place where another set of data that the committee could use. So if we're looking for, if a question was, I'm just making this up, how much anatomy time, in class time that we're using in our RMC community curriculum. The question was, what other schools are doing, this is a data source that we can draw down to see if we can figure out that question. If we're looking at the workload data, which we'll go a little bit later, about how much time we're spending in class versus otherwise from RMC versus other, the curriculum inventory is also another place for us to be able to draw an additional data set. Next slide, please. So the data from the curriculum inventory is used for our program expectations, mapping of content, informs our USMLE reports. It is a bridge to the assessment inventory that's based on the topic structure that we have. It also, of course, informs our course reviews and also content initiatives and continuous quality improvement for the curriculum. So this is a very pictorial version of that, and we're talking about, you know, what we're teaching, and we want to figure out where we're teaching it. And when we talk about curriculum inventory, you'll hear often a curriculum map. So a map is telling you what we're teaching, where we're teaching it. And then for the clerkships, you can also know where a particular topic is taught, and if you can go more in depth, or you should be introducing the topic as a foundation. So curriculum inventory also helps folks who are content creators to be able to see what type of mastery and depth their students have before they get to you. Next slide. So in our system, everything is organized in a hierarchy, and similar, if you have what you're teaching, if you start off with that role, again, those eight roles of physician plus medical knowledge as the role in red here. And then you have your program objectives, so the things that you want us to learn, which is in blue. And then each of the systems associated with it, so it's a cardiovascular, endocrine, et cetera. And then you have the topics. The objectives, again, are how you want to demonstrate students learning in that particular topic. For curriculum mapping, we're looking at what you're teaching as a teaching events. And so versus clerkship or a pre-clerkship phase, we're looking at what's happening in that year, in that course, and then it drills down into what topic associated with it and then objectives. So I think this is very similar to the last slide. So again, it's an example of a hierarchy where in the hierarchy for our curriculum inventory is the same as it is for roles or the medical knowledge disciplines. So you may see in a lot of our curriculum materials, these codes next to it. The only thing that these codes connote is that when that particular topic or event objectives, and we call the learning objectives event objectives in RMC, came into the curriculum. That's the only the meaning of those codes, but it helps us be able to track where our content is. So each of the content pieces in the pre-clerkship has a particular code. And so if, for example, and Jamie's here, this is an introduction to communication skills topic, that topic also has content associated with it. And it also helps the assessment team track the performance of that topic in the curriculum. And so the basic science, similar structure, you may hear a lot of TO codes or PO codes. And so the PO codes being program objectives, CO codes being course objectives, TO, et cetera. Thank you. So again, you have the topics that have a running list for every event, and we map those events to a particular curriculum inventory. So in your course review packets for the curriculum side of that data, you'll have a curriculum map that is for each course. So you'll see what the course was teaching, were they teaching the right topics, do we have a good distribution of roles or program objectives, and that's what you'll see in your course review packets. Okay. Do you want me to do this slide, Michelle, or you want to?
Either way.
Okay.
Hold on. I'm not muted. You can hear me okay?
I can hear you fine.
Okay. So one of the things that we do take into account with reviews and will be in the review data is workload. We want to make sure that students do not have more than 40 hours per week, including self-study and in-class activities combined. And that also includes some specifics regarding service learning and other programs, and we have broken it down by how much should be in person versus how much independent time. But that consideration and that data is in our packets. So here are some terms. I think Princess has already gone through them. So self-study guides, student guides are what the student receives for in-class activities. Faculty guide is the student guide with answers, and the self-study guide is put together by the course director for kind of the plan of study.
And Michelle, I don't know if we said this in the workload, for that workload policy was for the pre-clerkship, but we have the duty hour policy for the clerkship.
Correct. Yes. Yeah. Everything so far that I've discussed has been focused on pre-clerkship, although I guess the curriculum inventory is not just pre-clerkship. So when we get to the clerkship curriculum, so just wanted to give an introduction to that. So there's, of course, the usual M3 clerkships that we kind of went through already. In addition, one of the things that we're going to be reviewing is this CRASH program, the Clinical Resources and Skills for the Hospital. So every incoming M3 student takes this in May to reinforce some of the clinical skills from M1 and M2 years, introduce a few new skills so that the transition to the the clerkship curriculum is smooth. And so it's a week of various activities and kind of history and physical exam, practice sessions, etc. So that introduces the clinical clerkships. Then there's the usual clerkships. And finally, new in the last probably 2 years is a longitudinal course spanning the entirety of M3 year. So just like there's some activities M1 and M2 year, we have longitudinal courses, both M3 and M4 year, where we have extra roles curriculum and activities that kind of tie some of the themes together that students may see, but may not fit well into one particular clerkship. And so students are enrolled in this longitudinal course simultaneously with their core psychiatry, neurology, or whatever rotation that may be. So we've organized at Rush into super blocks. So there are 3 16-week super blocks in the M3 year. And a third of students will start on each of these super blocks. And so you can see how kind of how they're paired. Medicine is paired with psychiatry, neurology. We have elective time paired with OB-GYN and surgery, etc. And so students will generally have the same cohort in each of these super blocks as they follow kind of sequentially. M4 year is a little different. We have our transition to residency course, which is the longitudinal course for M4 years. The name is Transitions to Residency. And like the M3 course, the entire graduating class will take this course. It has roles curriculum. It also has a little bit of time for interviews, time for step preparation for USMLE tests, and some student affairs content as well, kind of how to interview advice, mock interviews, things like that. There's also 12 weeks of required courses. Every student is required to take one sub-I, could be in a variety of disciplines. Every student is required to take 4 weeks of emergency medicine, and every student takes 4 weeks of clinical bridges. So clinical bridges is mostly non-clinical rotation that all students are required to take in March. When they match is during this clinical bridge period. It again also has some kind of roles curriculum, kind of the pre-residency boot camp, any skills we want students to know prior to beginning residency. And students also have 24 weeks of elective time, split between patient care and non-patient care and aways. So that kind of sums up our M4 year. Here's just a picture of our classrooms, and I think we are nearing the end. So I just know this is a lot of information and probably very overwhelming and confusing. And so I apologize for that. It actually is not as, hopefully isn't as overwhelming as it seems with all of this information. Again, we have a lot of support available for questions and discussion, and we just wanted everyone to have some kind of idea of who is who. And when we use some of these terms like CI, curriculum inventory, know what it is we're referring to. But there'll always be people who are happy to explain over and over as needed what the layout is and some of these terms as needed. So again, try not to let the amount of content be overwhelming. It really is not as intimidating as this probably made it seem. So does anyone have questions about abbreviations we've used, who's who, our pre-clerkship or clerkship curriculum, or any of the specifics regarding kind of curriculum inventory and how that's mapped? Feel free to put anything in the chat as well. If there's no additional questions, again, I don't have any.
I had a quick
Yes.
question, and this, Princess, thanks, first of all. I know this was a lot to go through. Thank you for that. And I'm guessing the slides are also going to be made available.
Yes.
As well. Thank you.
We will make the slides and the entire recording available for, there were a lot of people who couldn't come on the short notice on a kind of Friday at noon. So it will all be available.
Thank you. So just a quick question. So as we review courses in pre-clerkship and clerkship, how granular are we getting? Princess talked about TOs, topic objectives, program objectives, these different types of objectives. When we're reviewing a particular course and a discipline within that course, exactly what are we reviewing? How granular are we getting?
I think the goal is not to be getting too granular because we have the entire course to review. So I don't think any of us want to be at topic level type activities. In addition, the disciplines, especially for pre-clerkship, will be reviewed separately in a medical knowledge review by roles and threads. So, big picture thing I think is much more important. We're not teaching endocrine system, in this course that needs to be taught in, or, students are, saying that the content is disorganized. I think larger themes are far more important than granular detail. If we say, there's issues with the anatomy curriculum, X, Y, Z, and then we'll send it back, the anatomy team will sort through the granularity.
It also depends on the committee. So the roles and threads use the topics because that's the way it's mapped for the assessment inventory, is mapped by the topic level. So depending on your committee and what questions you're trying to answer is the use of, if you need to go granular or not, you have it available to you if you have specific questions. From the pre-clerkship side, the course objectives right now are not as descriptive of what is in, like right now, the course objective for anatomy is they apply the concepts of medical practice to anatomy. And so if you want to know what that means, the topic names may help you figure out if that is the right thing that should be taught in that course, for example. But that's different from clerkship because that their course objectives are a little more descriptive.
Thank you.
But for action items, I really don't anticipate us discussing action items on that granular level.
No.
Other questions? If not, feel free to reach out to me with any additional questions, and we'll have this material available. And again, I appreciate everyone for coming today and being involved. Thank you.
Thank you.
Thank you.
Thank you.